Here are 9 times when you should stop working out immediately. 1. You haven't sought medical advice. Dr. Jonathan Drezner, a family medicine physician at the University of Washington who specializes in sports medicine, to that if you're at risk for heart disease, you should consult your doctor before starting an exercise program. Your doctor, for example, may give you particular instructions on how to exercise safely after a heart attack. The following are some of the risk factors for heart disease: high blood pressure, high levels of cholesterol, diabetic complications, a brief history of tobacco use, a history of heart illness, heart attack, or sudden death due to a heart condition in the family. All of the preceding. Young athletes should also be examined for heart problems. The saddest tragedy of all is sudden death on the playing field, says Drezner, who specializes in sudden cardiac death prevention in young athletes. Those with known heart illness or risk factors for heart disease, such as diabetes or kidney disease, may benefit from a more extensive medical screening to ensure they're safe to begin exercising. Dr. Jeff Tyler, an interventional and structural cardiologist with Providence St. Joseph Hospital in Orange County, California, says, anyone having troubling symptoms such as chest tightness or pain, unusual exhaustion, shortness of breath, palpitations, or dizziness should consult their doctor before beginning an exercise plan. He says, Point 2. You progress from 0 to 100. Out-of-shape persons, who can benefit the most from exercise, are also at a higher risk of experiencing abrupt heart problems while exercising. That's why, according to Dr. Martha Gulati, editor-in-chief of CardioSmart, the American College of Cardiology's patient education project, pace yourself, don't do too much too quickly. And make sure you give your body time to recuperate between workouts. Another reason to take a step back and think about what you're doing is if you get caught up in a situation where you're doing too much too fast, says Dr. Mark Conroy, an emergency medicine and sports medicine specialist at the Ohio State University Wexner Medical Center in Columbus. Whenever you're starting to exercise or reintroduce activities, it's far better to do so gradually than rushing in headfirst. 3. Your heart rate does not drop when you lie down. Torres advises that you pay attention to your heart rate throughout your workout to see if it's keeping up with the amount of effort you're putting in. Of course, we exercise to increase our heart rate, but it should begin to decrease during rest intervals. If your heart rate remains high or beats irregularly, it's time to take a break. 4. You're having chest pains. Chest pain is never normal or expected, says Gulati, who is also the division chief of cardiology at the University of Arizona College of Medicine. Exercise can cause a heart attack in rare cases, according to Gulati. Stop working out and call 911 if you get chest pain or pressure, especially if it's accompanied by nausea, vomiting, dizziness, shortness of breath, or excessive sweating, Gulati recommends. 5. You're out of breath all of a sudden. When you work out, if your breath doesn't quicken, you're probably not working hard enough. Shortness of breath caused by exercise differs from shortness of breath caused by a probable heart attack, heart failure, activity-induced asthma, or another illness. If you can accomplish an activity or level with ease and you suddenly get breathless, stop exercising and visit your doctor, Gulati advises. 6. You're experiencing dizziness. Most likely, you overworked yourself or didn't have enough food or water before your workout. However, if pausing for a drink or a snack doesn't help, or if the lightheadedness is followed by profuse sweating, confusion, or even fainting, you may require medical assistance. These signs and symptoms could indicate dehydration, diabetes, a blood pressure problem, or a nerve system issue. Dizziness could also be a sign of a heart valve disease, according to Gulati. You should never feel dizzy or lightheaded after an exercise, Torres adds. Whether you're doing too much or aren't hydrated enough, it's a solid sign that something isn't right. 7. Your legs are aching. Cramps appear to be harmless, yet they should not be ignored. Leg cramps during activity may indicate intermittent claudication, or a blockage of your leg's main artery, and should be discussed with your doctor at the very least. Cramps can also occur in the arms, and no matter where they occur, Conroy adds, if you're cramping, that's a cause to stop. That's not always going to be tied to the heart. Though the specific cause of cramps is unknown, it is suspected that they are caused by dehydration or electrolyte imbalances. I think it's safe to say that dehydration is the number one cause why people start cramping, he explains. Potassium deficiency can also be a factor. Dehydration may be a serious problem for the entire body, especially if you're exercising. If you're out in the heat and your legs are cramping, it's not the time to push through. Stop what you're doing right now. Conroy suggests cooling it down to relieve cramping. He recommends using an ice pack or wrapping a moist towel from the freezer or refrigerator around the affected area. In addition to stretching, he suggests massage the strained muscle. 8. Your heart rate is irregular. If you have atrial fibrillation, or an irregular heartbeat, or another cardiac rhythm condition, it's critical to monitor your heart rate and seek immediate medical help if symptoms arise. Fluttering or thumping in the chest are symptoms of certain illnesses, which necessitate medical attention. 9. Suddenly, your sweat level rises. According to Torres, if you observe a significant increase in sweat when undertaking a workout that normally wouldn't create that amount, it could be an indication of danger. Sweat is our body's way of cooling down, and when it's stressed, it overcompensates. So, if the increased sweat output can't be explained by weather conditions, it's better to take a break and figure out whether something more serious is at work. It could be harmful to ignore these warning signs. Also, don't forget to take a break. A good exercise routine includes not just workouts but also rest and recovery days. Working out hard is excellent, but on our leisure days, we just adapt and improve.